All right, thank you for all being here today and joining here on this day in Rhode Island with Lieutenant Governor Matos and members of my cabinet. And I thank each and every one of them for their work in preparing for today's presentation. Back in March, when I became governor, Rhode Island was a different place than it is today, being one of the most infected states in the country on a per capita basis. We were a big, bright, red hot spot in the nation's COVID map. Harvard University, I just gave Rhode Island an F. Ranking Rhode Island was in the bottom 10 states nationwide for coronavirus deaths, in the bottom 10 vaccine doses administered, in the bottom 10 for the use of available doses, in the bottom 10 for the speed of getting shots into arms. Together, we significantly turned that around. We immediately got to work partnering with municipalities to get more shots in the arms of Rhode Islanders, prioritizing teachers and childhood staff, child care staff, so that we could work to get schools back open and kids back in the classrooms. I just visited Westerly schools as well as Smithfield schools this morning to get an update on what that looks like, and it looks good. And now today, because of all the work that we've done together, Rhode Island has one of the highest vaccination rates in the nation, with over 88% of our adult population vaccinated with one shot in the arm, and over 80% of the adult population fully vaccinated. Rhode Island has the second lowest coronavirus test positivity among the 50 states over the last 7 days. And we're 47th in the current number of COVID hospitalizations, and 46 for the deaths. One of the lowest death rates in the country, and we've been able to have that all through the Delta variant. Rhode Island aggressive vaccination and public health responses have positioned Rhode Island as a leader in the country as it enters the post-COVID economic recovery. The recovery has been strong for Rhode Island businesses and workers. In fact, the state reported a 7.5% increase in real gross domestic product in the second quarter of 2021, exceeding the growth rates of the United States and the New England region. Rhode Island has also ranked among the top 10 states nationally and led the Northeast and Moody's Back to Normal Economic Recovery Index for the last several months. As of October 1st, Rhode Island ranked 4th in the nation and 1st in the region. While Rhode Island is leading the economic reopening, as I said before, we can't take our foot off the gas and allow other states to catch up with us. Rhode Island is the only state in the Northeast that has not spent $1 of its American Rescue Plan state fiscal recovery fund. The $1.1 billion received from the Biden administration. I believe that we must begin using a portion of these funds in the short term to invest in our small businesses, in Rhode Island families, their child care needs, and their housing needs. That's why today I filed a supplemental budget amendment with the General Assembly that would allocate 10% of the American Rescue Plan state fiscal recovery funds to make a down payment, a needed down payment on Rhode Island's economic comeback. Our down payment proposal tilted Rhode Island, titled Rhode Island Rebounds, would provide an immediate investment into Rhode Island's families, workers, and small businesses. I want to thank both Speaker Sakachi and President Ruggiero for meeting with me regularly over the last 6 months to discuss, among other things, my administration's plans for both short and long-term investment strategies of these funds. The budget amendment includes many of the priorities that we all agreed were important to my team, and I appreciate the feedback and insight they provided throughout the process of finalizing this proposal. I'm going to walk through some of the top lines and details of the budget submission, then I'll turn it over to the Lieutenant Governor to provide some remarks, and then we will open up the questions for our cabinet members. Joe Cadiga, our budget officer, along with members of my cabinet, will also be around after the Q&A in case you need any additional questions or need any clarifications. Start with small businesses and impacted industries. Rhode Island small businesses have been hit hard by the COVID-19 pandemic, and while both the federal and state government have provided a range of small business resources and supports, there are clear gaps and ongoing needs, especially as variants pose continued challenges to consumer confidence. My budget amendment proposes investing $32 million to support small businesses and impacted industries. This includes $12.5 million for direct grants to provide immediate financial support to small businesses affected by the pandemic, with the aim of delivering 20% of these funds directly to minority-owned businesses. $10.5 million for technical assistance to support businesses in capacity building and upgrading technical infrastructure, and $7.5 million for increasing outdoor activities, maintaining clean and safe business districts, and for public health improvements like HEPA filters and ventilation, and $1.5 million for outreach, reporting, and compliance. Additionally, my budget amendment invests $13 million in support the recovery of travel, tourism, and the events industry. Commerce Secretary Pryor is here, and he can provide additional details on the breakdown of the travel, tourism, and events industry's proposals, as well as answer questions on the small business initiatives. We also propose to invest in our children, families, and social supports, $38.5 million. High-quality, safe childcare is essential to the well-being of children and their families. Unfortunately, the childcare industry has been hit hard by the pandemic and is struggling to attract and retain workers due to low wages, driven by a long-standing lack of public investment. Childcare educators and providers continue to do the heroic work supporting young children and ensuring families can re-engage with the economy. And the staffing crisis threatens childcare's ability to provide enough capacity for every family needing a childcare seat. Our down payment plan calls on investing $13 million to provide retention bonuses to supplement baseline wages for over 8,200 childcare workers, as well as assistance to new family childcare providers entering a market that needs expanded capacity. We heard that from our childcare providers yesterday when we met in Ward. Additionally, our down payment proposals invest $12.5 million in federal funds for the purpose of providing workforce stabilization payments to the direct care staff of the service provider organizations contracted by the Department of Children, Youth, and Families. As a result of the public health emergency, many children could not access regular preventative primary care. This has led to delays in routine vaccinations for children, developmental screenings, lead screenings, and other vital preventative care that ensures healthy development. Data from the last year shows racial disparities in access to pediatric care, which must be addressed. Our budget amendment provides $7.5 million in federal funds for the purpose of this pediatric relief program. The funds will assist pediatric primary care practices to retain staff, implement extended hours, conduct enhanced research and outreach, and bring additional family supports, such as social workers, to address the crisis and ensure all families are caught up on their care. Early intervention provides essential childhood development services that support healthy outcomes for our children. Due to the pandemic, early intervention providers face significant losses due to the current rates, and today are struggling to hire and retain the staff needed to provide services to all children needing early intervention programs. As of today, 4 of 9 early intervention providers are closed to referrals. Our budget amendment invests $5.5 million in federal funds for the purpose of assisting early intervention providers to mitigate the economic impact of the pandemic, recruit and retain workers, avoid further closures, and provide continued service to children with developmental needs. I have members of my cabinet here from across the Executive Office of Health and Human Services, including Director Coyne, Dr. Schaefer, and Ann Novus, who is the Chief Staff to the Secretary Jones, couldn't join us today. She's dropping off a daughter at college with family matters. They will be happy to answer any of your questions regarding these issues. Third, investing in affordable housing and housing stability supports. We're proposed to invest at this moment $29 million. As we all know, Rhode Island is experiencing a housing crisis, and while the state has taken major steps to address it in this past legislative session, more needs to be done, and it needs to be done now. Our down payment plan would invest $15.1 million to incentivize the development of affordable housing. The investment would be targeted at assisting individuals with an income below 80% of the area median income. Further, our plan would invest $12.2 million for a property acquisition grant program. The funds would provide for a grant program that would finance the acquisition of properties for redevelopment as affordable and supportive housing. This initiative intends to increase the supply of quality, affordable, and supportive housing while strengthening our communities. Finally, I'm proposing to invest $1.6 million in stability services and developing a real plan to provide affordable broadband internet for every Rhode Island family. Commerce Secretary Carol Ventura from the Rhode Island Housing and Kim and Hearn from my staff are here to answer any questions related to our housing proposal. I'll close by saying this. We need to make these investments now. The state of Rhode Island has made too much progress over the last 7 months not to invest these dollars. But this is just a down payment on our economic recovery. There's much more we should do over the long term in areas such as infrastructure, climate change, public health, education, small business, and housing. And I expect that we'll be able to debate how the balance of the dollars, the 90% of the dollars, would be spent in the long term to address these issues. Making investments in short term and long term can complement each other to bolster Rhode Island's economic recovery. And I look forward to working with my partners in the General Assembly so we can begin allocating funding soon as to safeguard our recovery and to ensure a more resilient, equitable, and prosperous state for all, and also making sure that we keep people safe, healthy, economically strong, and our children and our students back in the classroom. I want to hand it over to Lieutenant Governor Matos first, and then I'll take your questions. Lieutenant Governor, there you go.
Good afternoon. Thank you, Governor. Thank you for putting forward this plan to make a down payment on the future of Rhode Island and the Rhode Island families. We have been working really hard to make sure that Rhode Island comes back strong after this pandemic. This is just a down payment that's going to help us to get there. I have been visiting all the cities and towns, 39, all of them, and the one thing that I keep hearing from all of them is that the concerns that the residents have. They have concern about the workforce. They need to have more workforce. They need to, the workforce cannot get there because of the need of child care. So this down payment is taking care of the crucial issues that have been affecting our communities. We need to invest in affordable housing, which is one of the priorities of my office. We have been doing a lot of work on. So this proposal is putting a down payment also on affordable housing. We're putting a down payment on child care. And we also invested in the future of our Main Street businesses and the urban core. which is so needed to make sure that our urban community is thriving. We also make an investment in supporting the families, to make sure that they're not being left behind. We're also making an investment, we're putting a down payment to make sure that we address the problem of addiction and make sure that we meet people where they are. These dollars are once in a lifetime opportunity to make real change in the state of Rhode Island. For too long, we have seen the needs that we have in the state of Rhode Island, and we never had the opportunity to write a check to start addressing those situations. Right now, we have that opportunity to write a check with this down payment proposal to make sure that we start addressing those problems. We can make a difference and we start working together with you, Governor, and also together with our partners in the General Assembly to make sure that we put these resources to work to ensure that every family in Rhode Island has a chance. Thank you for investing in housing. Thank you for investing in child care. Thank you for investing in workforce. Those are the things that are going to make a difference in the state of Rhode Island for us to come back from this pandemic and to come back stronger. So with that, I'm just gonna say thank you once again. Looking forward to working with our partners in the General Assembly to make sure that this proposal is approved. Thank you.
Governor, the Lieutenant Governor has just said this is a once-in-a-lifetime opportunity to spend on some areas that are not neglected, perhaps. I'm looking to see if you have a big-picture guiding principle that helped you choose these investments.
Yeah, so these investments are down payment, as we said. This is to keep the momentum going that we currently have and address some specific issues that relate to the economy, the families, and the state, as well as housing. As I mentioned, this is 10% of the funds. 90% of the funds, we certainly are going to continue to work on the road to 2030, work with different partners and talk about how those are being invested. And right now the discussion is wide open where that goes in our economy, into our child services, into our housing, into our areas that make a difference to our families. But this here is not meant to be like the total solution, and certainly we're not proposing the entire amount of dollars at this point. This is where we see it's really important. If we don't maintain our recovery on the economy, investing in the economy, then we'll be in that state where we'll fall back to be the first in and last out of these economic downturns. We have talked to the business community. We know that they need assistance. This is not everything that they're going to need, but it certainly is going to keep the momentum going. The child care issues are the same thing. The housing issues, I mean, that's something that is just, we need to be creative and strategic and get the ball rolling on the housing.
So this goes beyond health and safety and gets into business and economic recovery.
Yes, and I think that we're at that spot. I just outlined where we are as a state right now, second lowest infection rate in the country, lowest hospitalization rates. I think we went under 100 yesterday. We've dealt with this Delta better than any state that I know of. And so this is where I mentioned that we're going to do the health first. We have that in control, although we've got to stay cautious on it. I mentioned that we would make sure that we're going to have a recovery that's going to work for everybody in Rhode Island. And then also I mentioned that we get kids back in school. So those have been clearly the three priorities. I think that the focus of this is on this 10% is in those categories.
Governor, did all these issues arise because of the pandemic that you're trying to fix with this?
Well, the economy, in terms of the businesses, we know the struggle that they've gone through, in particular the small businesses, and that was directly related to the pandemic. The child care issues, I think that a lot of the staffing issues are a direct result. We had staffing challenges prior to the pandemic, but they've been exacerbated tenfold right now in all our industries, but in particular in the child care. And in the housing, we've always known we'd have an issue there that needs to be addressed on a 39 city and town basis. And this gives us the opportunity to start doing that.
But is this an opportunity to use, if my math is correct, $113 million, which is 10% of the $1.13 billion, to fix a lot of things?
I look at this as continuing the momentum that we currently have. The opportunities the pandemic has provided some really big opportunities for the state of Rhode Island to reset some of the issues that have to do with our business environment, our child care, and our housing. And that's just like the beginning of the down payment. But yes, the pandemic is an opportunity that we want to take advantage of with the federal funds that have come in and then other resources that we believe are coming in terms of infrastructure. It's a total plan to make sure those dollars are invested properly.
One other question, why hasn't any of this money been spent in Rhode Island yet? Is it just sitting in the bank collecting interest? How does that work?
Well, I think it's, I made a commitment when I became governor that we were going to work with the General Assembly on these important issues. I wasn't going to govern by executive order. I wasn't going to assign, contracts through the emergency order. We're going to work with the General Assembly, and that's what I mentioned in my comments, thanking the Speaker and the Senate President for talking to us on this thing. They're very up to date on what's going on. Now we need an action by the General Assembly on this supplemental budget.
Governor, 2 questions on your workforce. One, is there any supplement to minimum wage in this first 10% rollout? In other words, workers who are making minimum wage, perhaps to encourage them to go back into the workforce or to support them getting closer to a living wage. Is that something that's included?
Well, on the child care areas, it is. I mean, we're talking about supplementing 8,500 people's pay. I think that's a byproduct of the question of what's come as a byproduct of the pandemic is the value of our hourly wage workers, right? And I think that's going to be reflected not only in the down payment, but also in the long-term strategy.
And when you say small business, does that include micro entities, organizations of 1 to 4 people, maybe on Broad Street? Are they going to be included in this rollout?
Yes.
Governor, I'd like to be able to pin down a few details of a couple of your proposals.
I may have to go to the staff for the details, but
That's fine.
Is that okay?
That's fine.
Which one we talking?
They're all here.
Yes.
Actually, at least 2 of them, including one I haven't met yet. Starting off with the affordable housing, something for people below 80% of median. What's the something? What exactly are you offering to who? Is it additional rental assistance? Is it help buying a house? What is it? And then I'll move to other categories.
Yeah, so I'll refer back to Stefan on that one, but I would say on the housing issue, it's a combination of things, right, that was outlined in my comments that has to help with assistance on buying houses, assistance on providing incentives to people who will build the properties that we need, and again, it's a combination of what we just talked about. Is that where's the opportunity here? We've spent a lot of time on Tuesday talking about the rental assistance program, the $200 million. All this has to dovetail together. So the efforts of getting all these dollars out in a way that helps in terms of the housing. But I'll defer to Stefan on the specifics of where we think that where these dollars can make the most sense immediately.
Before we go to child care, can we get an answer to that one?
I'm sorry.
Yeah, no, this is fine. I said before we get to child care, we get an answer that something that's for people 80% below 80% median. What is the something?
Each of the components of the governor's housing proposal in the down payment can address lower income residents. Housing prepared for folks who are 80% of median income or below would be included. So I'll explain a bit more. So the governor outlined this, but there's $15 million for the development of affordable housing units, whether new units or renovations enabling lower income housing units to be produced. In those cases, in many instances, we're below 80% of AMI for those who are served. So that's category 1. Category 2 is site acquisition. It's a $12 million allocation for the purpose of acquisition. That will enable us to acquire properties for the purpose of repositioning them to serve the neediest families and lower income families. In some instances, it's to prepare for the development of affordable housing. In some instances, it's specifically to serve homeless communities. we've used these funds for these purposes in the past. All of them, Kathy, aimed at lower income communities. And then there's a housing stability program, which $1.5 million or so. Housing navigation, stabilization, mental health services, wraparound services to help some of our neediest families. So I think what we get a sense of, and I've tried to create the strand for you across them, is that lower income communities and lower income families are the priority in what we're describing. Sometimes when you develop affordable housing, there are mixed income communities where there are lower income units mixed into an assortment of income thresholds among the units. So that could occur, but the priority is serving our neediest families.
Okay, so it doesn't go to the families, it goes to the people creating housing for this target.
Yes, this is for the development or the renovation or preservation of affordable housing units or for services associated with these housing units.
If you'll bear with me just for child care, I appreciate it. The raises, the retention bonuses, are they also going to the home-based child care providers?
Yes,
Yes, they are, okay. And are the ones, the workers in both the home-based and the child care centers, are they all SEIU represented?
No, they're
Just the home-based?
yes.
Okay. And then my last question on this is, I looked at the House fiscal analysis. Apparently the legislature put an enormous, I'm looking at both of you because I'm not sure.
I'm the
You're the
civilian
first,
from DHS.
okay. The legislature put a significant amount of money into child care, raising the reimbursement rate somewhere between 50% and 60%. And now, I guess, this is additional money on top of that.
Yes.
And I guess I'm asking why, with a significant, they're now up to, I think, $74 million in appropriations from the legislature, up from about 66. Why do we need all this additional money? Why didn't they take some of the additional money they were given and give bonuses, raise the pay of their workers? Did anyone explain that?
So I think,
Can you speak at the microphone, please?
sure. So in terms of my math, you've got the numbers there. I'm not sure about that, but I think your question is, and there was cars going by when you were speaking. Could you just rephrase that for me?
Okay, I'm trying to understand, given the significant increase that the legislature gave the child care industry, significant, many millions of dollars, and they raised their rates somewhere between 20 and 26% between toddlers and school-aged children. And now comes another big chunk of money. Was there any analysis of how they spent the increase the legislature gave them for this year?
Sure. This is very close to mine. I would say, in terms of from DHS perspective, at least 90% of the grants that we gave out, which is part of the ask that you have, that we used towards bonuses and retention to keep the doors open and the classrooms open for children. So there were some analysis done, so we know based on the funds that we gave out, roughly, the percentages of child care centers that use them towards the workforce.
What did they do with the huge increase the legislature gave them? I guess that's my question.
I guess I would refer to my staff and I'll go back and get the detailed answer for you, but I know that we have done some analysis. We know that it was used. For example, over 100 centers closed. We were open. The funds were used towards reopening 52 of them. So these are the types of services that these are the types of funds that we use to reopen the doors of some of these centers that we know were closed because of the pandemic. So I'm happy to talk with my staff and come back with you more details. Okay.
Thank you.
All right. Thank you.
Alexa.
Governor.
Alexa, and then Steve.
All right.
Hi, Governor. The investments in pediatric care, how exactly is that going to work? Is it going to go towards private practices, or can it go to Hasbro Children's, which is owned by the largest healthcare system in the state?
Yeah, so I'll defer the specifics there. Back to Kathy's question quickly was that, we met with the child care industry yesterday. They have multiple they're not able to serve the number of kids they have, and they're very stressed in terms of their employment, in terms of people there. So I think that whatever we put forward has not been enough to get them through this, this crisis that they're in right now, which is staffing and taking care of the kids. And I believe that they've stopped taking applications from families that need help because they don't have the staff because of multiple reasons, but including pay scale. Pediatrics, that's not an area that I really know a lot about, so I'm going to defer that out in terms of Dr. Shea.
Thank you. The direct answer to your question is we anticipate making it available to all pediatric and any family care doctors that also see pediatric patients. Right now, Medicaid covers 55% of all kids in Rhode Island, so we want to make sure that those Medicaid kids, as well as all Rhode Island children, have access to the pediatric care that they need, no matter where they see their pediatrician.
And how will this help population health, not just now, but possibly in the next 5-10 years?
Sure. So a lot of what we're looking at for this investment in pediatric care has to do with that preventative care that you get when you see the doctor. So we've seen back in the pandemic, childhood vaccination rates decline, rebound with continued investments, and then decline again as the pandemic heated back up again. Similarly, for developmental screenings, referrals to early intervention, which the governor's down payment also includes. All of these things, whether it's childhood vaccinations, developmental screenings, early intervention, children's behavioral health, all pay dividends down the line for kids, for families, for the economy, for education. Early intervention, for example, is proven to help children and families avoid the need for special education services later. So when we see these kinds of referrals, these kinds of challenges happen as a result of the pandemic, investing quickly and acting now to make sure that we don't carry that forward in the next 5 to 10 years is critically important to the recovery for Rhode Island.
Governor, follow-up question for you.
I was next. Governor, we have $50 million as a down payment on housing, but the true cost of dealing with the housing problem in Rhode Island is closer to $500 million, according to some General Assembly people. Are you committed to spending the money required to actually get to the root of the housing problem?
Well, we're proposing today to I think it was about 32.8 million, I think the number was. So that's what we're proposing to do and invest that area. And then the balance of the dollars that are available, we're certainly going to be considering more investment in housing. We don't know what that's going to look like.
Are we sure it's going to be to the scale of the problem? Because that's been an ongoing issue in Rhode Island. We don't have a plan that meets the scale of the problem.
Yeah, I agree. There's not a plan, and we certainly need a plan to determine what the number is and how much we need to invest and how we can leverage the dollars, right? Not only did we put in the budget a fund that's going to continue to be an annualized amount of money. We also passed a $50 million bond in terms of the housing. We're going to have assistance, that we need to make sure that we take all the resources and get a plan together so we know what it looks like for all 39 cities and towns to address the issue in housing. And then how are you going to leverage those dollars? So sometimes we're talking about leveraging dollars in the proposal today by incentivizing, right, the construction or the rehab of buildings. And that means that we want to leverage those dollars. So just because you're investing $50 million at any given point in time doesn't mean that you're only getting $50 million housing.
Right, I know.
We're going to leverage it. We need to have a plan, and when we expect people to make the plan work, we're going to expect that we're going to get partnerships as well to do that.
And following up on the retention bonuses for child care providers, that's like a one-time payment, but it doesn't really get at the root of the problem, because 2 years from now they'll still be underpaid and they'll still be thinking about leaving and getting other jobs. So is there a plan to get at the root of the problem for the child care provider?
Yeah, long term is probably a budget issue, right? Because these dollars are going to be spent, and then so you're going to have to roll in some strategies on the budget that invest in the child care. And that's what I committed yesterday to be really taking a strong look at that. The other thing I would really emphasize here is that these dollars that were appropriated by the Biden administration was to help assist us in the recovery, right? So The idea is that we want to make sure that those dollars are invested as was intended, which means to invest them in our recovery. Some of the long-term strategies, I guess we can certainly talk about with the 90%, but today these dollars are being intentionally marked out to meet immediate needs.
Thank you.
Is there broad support for this in both the House and the Senate? And if so, when could it pass, and when would you expect the money going out?
Well, we've been asking a meeting with the Senate President and the Speaker for several months on this issue, and we were asked to put it into a supplemental budget form as opposed to any other ask or any other mechanism that could trigger the use of these dollars. So I think that's a good question for the General Assembly.
All right, Patrick, and then Bill?
Governor, I'm following up on childcare. Staffing shortages are happening across numerous industries: bus drivers, nurses, restaurant workers, everywhere. So one is supplementing the incomes here in this industry just going to put more pressure on other industries and trigger new requests from those industries to help pay workers. In part two, following up on what Steve was asking, it sounds like we're committing the state to an ongoing permanent funding of these workers' pay. Otherwise, they're going to be facing a pay cut a couple of years when this money runs out. Is this, in fact, committing the state to kind of permanently putting in a line item to fund their pay?
I think it's committing the state to do what we need to do to get the child cares giving the service, providing the service that we need. Again, I want to. This is a short-term strategy for immediate concern, and that's what we're appropriating dollars for. If we were looking at longer-term things, we'll definitely be putting that in our budget of how to spend the other 90% when I present the budget in January. So those things are being talked about right now. So these are immediate needs that are not long-term solutions. They're immediate needs as a result of the pandemic, and that's why these dollars were appropriated, for us to work our way through in a way that we're not weak when we come out of it. That those are what these dollars were intended to use for. These dollars were used to help in the recovery. They're not necessarily long-term strategies, and we have to be careful. You've heard leadership speak about this, and I have too. You don't want to create programs that you don't have intentions or the ability to fund. But that's why these are specific to immediate needs. That's what we're asking the General Assembly to approve.
Bill, last question.
Secretary Pryor, with respect to housing, there's a great deal of recently and now formally affordable housing, lowercase a, that has turned into short-term rentals, Airbnbs, things like this, especially in the southern portion of the state on Twinning Island. Might owners of these properties be motivated to take advantage of this program to supplement their income and then in turn rent those properties back to the same people who were removed from those areas when Airbnb basically took over these areas?
The heart of your question, Bill, is about whether existing property owners and developers can get in on the act of producing more affordable units. The answer is definitively yes. So we've partnered, we have a number of mechanisms in place with which to partner with existing property owners. We can engage in site acquisition. We can also help to provide gap fillers to produce these projects. It certainly is the case that if a property, you're asking about a specific subcase, if a property is currently being used heavily for an Airbnb style use, absolutely, that could be an eligible property. So for those who are listening to us, who are property owners or developers, we would encourage you to reach out to Carol Ventura and the team at Rhode Island Housing. We do have a bond process, that is to say, our $65 million bond for affordable housing has an active set of rounds underway for allocation even prior to receiving these funds. So we can get started. We need the extra resources. Our first round of applicants for that more traditional bond-related housing investment program, we received $54 million worth of applications for a total $65 million program in round 1 of 3. So what I'm expressing is there is more opportunity to apply right now, but we need the additional resources that Governor McKee has set forth to enable us to partner with property owners as you described.
All right, thank you all.